So I am a mental health navigator. So what that role essentially is going out and seeing people who are under a WDH tenancy and completing an assessment with them of their needs. So essentially, when we're looking at someone's needs to do with their well-being and their mental health, we're looking at everything that could affect that. So that could be housing, social, finances, employment, a whole host of different elements. So our assessment covers all of that and hopes to gain a good understanding of someone's lifestyle and the way that they are at the moment and what they might need to change in order to improve, or support services or referrals that might need to go in order to get them the support to be able to change or improve. So essentially that's what we do, is that assessment and then signposting or short-term interventions that we can deliver ourselves. So we might do things like anxiety management, sleep hygiene, self-harm reduction, lots of different areas that can support people in the short term until they can get some support from services that can support for longer term and can provide more in-depth support for them. We tend to see people every 2 to 3 weeks. It depends on our caseload, because sometimes our caseload goes up and therefore we need to not see people as regularly to be able to get through the caseloads that we're holding. But we do see people face to face. It is in their own homes. If people prefer telephone, or there's some sort of risk attached to someone and going into their property, such as sort of needle stick injuries, that sort of thing, aggressive dogs, we might do appointments in community hubs that they can get to. So they still got the element of face to face if that's something that they value. Not a lot of services that are available now for mental health or to support someone offer that face to face in their property support. A lot of people that I see are agoraphobic or struggle getting out of the property due to physical health, mental health issues, and therefore actually providing that support in a place that feels safe to them, that they can access, is really key and paramount. In terms of building up a relationship as well, they know who I am, what I look like. They can see my body language and, that I'm interested and wanting to listen if they can see me in sort of person. Whereas over the phone, you don't get that much of an understanding of who someone is, or are able to build up a relationship quite as quickly as you are when you're face to face with someone. I also think the frequent contact that we have with people, them knowing that they're going to see us until they've got a support plan in place, is really key as well, because then they know that we're reliable, trustworthy, and a service that they can come back to. I think because I've come from an NHS background as well, it feels quite comfortable to come into a housing association with a link to something that you already know quite well. But us as navigators, being linked into the NHS means that you get all the benefits of working for the NHS alongside working within the housing company. And I think as well, from a personal standpoint, the access to NHS supervision and guidance from clinicians is really key. So I get supervision every month from a clinical member of staff over in the NHS, which really enhances my support that I can provide then within the housing association. I think that we bring a lot of hope to a lot of people that don't necessarily have that or wouldn't have that without this service. I was reflecting on this the other day, actually. The scheme is actually accessing a lot of people that potentially wouldn't be noticed by mental health services because of the situation that they're in, because of their vulnerabilities, potentially financial positions. These people are often under the radar and haven't the knowledge of where to go or what support there is, or if there is even actually any support. And so we are often the first port of call, and it's often picked up by people that you wouldn't expect. So, a plumber going in to do some work, or an estate officer. I feel very proud to have been part of this service and picked to work within this service, because I can see the benefit for it. And I do see that we are supporting those people that necessarily wouldn't have that support in place. So it is an honour to work within WDH.